It is 6:42. I'm Michael Cohen, and this is 1320 WILS. Now, listen to this. Imagine just simply by getting Botox in your forehead so you don't crinkle your face up and look unhappy. You can actually become happy and even come out of a depression. Well, that is apparently what we're finding out, according to a new study. One of the folks behind this is Dr. Eric Finzi. He's a cosmetic dermatologist, author of the book, The Face of Emotion. Dr. Finzi, thank you for joining us this evening.
Thank you, Michael. Thanks for having me on the show.
You're an author, you're a doctor, you're an artist, you're a painter and a sculptor also. How much television do you watch on any given day?
I don't usually have time to watch TV. I have to be honest.
Do you feel that by doing this art, let's say, does that help you as a dermatologist as in working with cosmetics?
Absolutely. Believe it or not, the art is what actually got me to do the Botox for Depression study in the first place, because I was looking at portraits of mental hospital patients, photographs from the 1880s, and they have some very, very severe expressions. And that led me to read the work of Charles Darwin and William James, and then that actually gave me the idea to do the experiment in the first place.
Okay, tell me, what was the experiment? What exactly did you find?
Well, we asked the question, that is, if you're unable to move the muscle between your eyebrows that helps you feel and look sad or angry, could that actually improve your mood? And the way to do that was to just do a one-time injection of Botox to prevent people from frowning. Now, it turns out that frowning is something you do a lot of when you're sad or you're angry. And we did the experiment in a randomized, double-blind, placebo-controlled trial, 74 patients, and the results were very strong. More than half of all the people who received it, and a lot of them were already on antidepressants or had tried antidepressants, more than half of those patients had a very significant improvement in their depression.
Wow.
In comparison, only 15% of the placebo did.
Over 50% of those, then you're saying, had this injection, said they felt better.
Much better.
That should be front page news. Were they able to get rid of their antidepressant medication?
Well, we did not ask them to change anything about what they were already doing. But in my own personal experience, I have treated patients who, subsequent to receiving this treatment, feel well enough that they're able to get off their medication. But
what are you saying? They're not frowning, and so they just feel better by not frowning?
We believe that it works by the brain is continuously monitoring your facial expressions, and that your mood responds accordingly. And we believe it's interrupting a neuronal circuit in the brain, and that frowning is just part of the circuit. That's all. And by interrupting that circuit, it's just harder for you to feel sad.
Interesting. Another time people frown is when they're concentrating sometimes. They squinch up their head. Do you think it might affect how well you can think, too?
We have not found that. As you know, Botox is FDA approved for the treatment of frowning for a cosmetic point of view, and it's been used for that purpose for more than 15 years now, and no one has had any difficulty with concentrating. But I do think that it does make it a little bit more difficult in many people to feel angry or sad. It doesn't stop it. You still can feel angry or sad. It just dampens the emotion.
I'm talking to Eric Finzi, a cosmetic dermatologist. You can find him online at ericfinzi.com. Where are you based out of, Dr. Finzi?
I'm in Chevy Chase, Maryland.
And in terms of Botox, how big is it nowadays?
I think it's probably the most popular cosmetic procedure out there right now. And one question I've asked myself is it possible that Botox has gotten so popular because possibly it makes people feel better and not just look better. I don't know the answer to that question.
What do you think? Do you think maybe it could be maybe part of their depression is the fact that they have all these wrinkles on their forehead, huh?
I don't think it has anything to do with looks. I'm perfectly happy to make people look better as a cosmetic dermatologist, but that doesn't compare to the great feeling that I get when I can actually change somebody's mental health for the better. Then that's so much more significant to me in terms of how I'm able to affect their lives. I grew up with a mother who suffered severely from depression, and so I saw depression firsthand from the time I was 5 years of age.
Oh, no kidding. And what? How did she cope with that? Did she get medicated? Did she get better at some point? Or?
She used everything that was available, and in the end, none of it worked. And towards the end of her life, she just went into this terminal slide, and modern medicine was unable to help her. And after she died, I really felt that I had to do something about this. I mean, it was a terrible thing that even though she was tried on all the medicines and shock therapy, she was still depressed. So, and that's still true today, that we have some great medications, but depression is a common illness, and it's common for people to remain depressed in spite of all the medicines we have.
Well, it's interesting.
So we need new ones.
It's interesting you went into cosmetic dermatology and not into psychology or psychiatry. What led you into that?
I believe it's because I've always been an artist, and I'm very visual, and I get to work with my hands as a cosmetic dermatologist. And in part, when I was younger, I was trying to avoid psychiatry because it was a little too close to home with growing up with a mother who suffered so much from depression. I was a little scared of it.
And when you're a dermatologist, a cosmetic dermatologist, you're not doing surgeries then? You're doing other procedures?
I do a complete variety, from surgery. I treat a lot of skin cancer, to cosmetic surgery, to liposuction. I do all of it. General dermatology. It's a very broad field. I do medical and surgical. But as I said, the satisfaction that I derive from making someone feel better inside, there's just nothing that can replace that.
Dr. Eric Finzi is a cosmetic dermatologist, author of the book The Face of Emotion. The Face of Emotion, do you get into some of this that we just talked about, or is that about something different?
Yes, in my book, I wrote the book in part because I wanted to explain what is the scientific basis behind why we did this clinical trial. I first published a paper in 2006 on this subject, and I felt that it was a difficult subject for people to get their heads around. And so I wrote a book to really explain it, and also to talk about my story and my mother and my art and how the whole thing came together for me, a lot of serendipity. And I owe much of what I came up with to Charles Darwin and William James.
What you said then, if I got it right, is there's a circuitry involved, and that part of it in our emotional circuitry is our face reacting. And if we kind of stop that, it kind of dampens the whole process. Is that right?
That's correct. There are many circuits in the brain, and facial expressions are part of certain neuronal circuits that feed back to the brain. Your brain is always monitoring what's going on with your body, and in this case, the face is very important to the brain, so it pays attention.
So try not to frown. I think that's part of the lesson here. Dr. Eric Finzi, the website, ericfinzi.com. Doctor, thank you so much for joining us.
Thank you so much, Michael, for having me.
Enjoyed it.